probably recognize the name Dr. Sarah Cody. You know, initially she was on TV a lot and getting a lot of these mandates and when we went into shelter in place. So the role of the county, the public health department, is really addressing any pandemic, keeping our county healthy, right? All of us in our county. And so now, as you know, it is to address the COVID-19 pandemic here in our county. With that, today at noon, if some of you were tuned in, there was a special announcement and it was an order actually. So our current order that was in place was updated at 12 noon. And basically that in announcing that the vaccination continues to protect against severe COVID-19 illnesses, but with the COVID-19 Delta variant now infecting a small percentage of vaccinated people, as well as many unvaccinated people, 8 Bay Area health officers issued health orders requiring masks indoors in public places. The order requires all individuals, regardless of vaccination status, to wear face coverings when indoors in public settings, with limited exceptions. And so that will begin tonight or tomorrow morning, depending on how you see it, and you might be asleep, 12:01 a.m. on Tuesday, August 3rd. So as of tomorrow morning, when you wake up, you are to be wearing your masks anywhere you go in public places indoors, with limited exceptions, but mainly those exceptions have to do while you're eating in a restaurant, but putting it right back on when you're done eating. And so that was the announcement given today. Now, what is COVID-19 and is the Delta variant COVID-19? Some people think it's different. Some people, you know, I heard, you know, wow, we're getting hit with another pandemic, but actually it's the same pandemic. And so the virus COVID-19, as you all know, is transmitted primarily from person to person through respiratory droplets. And the Delta variant is COVID-19. So, which is why we are being told now to wear our masks indoors. You know, wearing the face mask and staying 6 feet apart is a great way to continue to prevent the transmission. And again, outdoors is safer than indoors, always. The outside is always safer than being indoors for those reasons that I mentioned about the air droplets and being in the air. And these are just more reminders because I think, you know, it had been over a year that we had gotten this information. We had received this information over and over. What is COVID? And then we were moving into more of a recovery mode, right? Like less COVID numbers and, you know, more of the recovery. But I think it's important to remind people about these symptoms, especially now, right? With the Delta variant going around. So call your doctor immediately if you have any of these symptoms: fever or chills, cough, shortness of breath or difficulty breathing, sore throat, fatigue, muscle or body aches, headache, loss of taste or smell, nausea, diarrhea, or vomiting. So very important to keep these symptoms in mind. And, you know, just reminding of the resources we have in our county. Again, so the COVID-19, the vaccinations and testing is free, safe, easy, and confidential. I know Jose started off with a wonderful announcement about an event that the Indian Health Center is having this Friday. That's great. You know, I think the more community events we have, the more options our community has is important to, one, get the vaccine and get the resources needed. And so through our county website, the scfreetest.org, you can go there, you can make an appointment. You can support your parents, your grandparents, you know, your neighbors if they want a test and they might not know how to navigate. Feel free to go on there. There's English and Spanish. And then also the vaccine, you can go through scfreevax.org, and in Spanish, you can go to sccvacuna.org to make an appointment for vaccine or just to see the list of where we are open that week. And so a summary of the prevention methods are absolutely get vaccinated and encourage others to get vaccinated if they haven't. Use a face mask now indoors and outdoors, you know, whenever possible. Maintain at least 6 feet distance from others. And again, outdoors is safer than indoors. Continue to remember those things that minimize the transmission of COVID-19, the Delta variant. And so I want to review some numbers in our county. These are last updated on July 30th, which was Friday. As you can see, I'm going to go over a couple of numbers here that I think are important for our community here today. Is if you can see on the top left, the age group. Sometimes I think when it first started, we all thought it was something that the elderly were getting. But we see here that a lot of our numbers are in our youth population. So if you see 19 and under, it's 18.7% of those getting the COVID. And then we have 20 to 29, 19.8, and then 17.7. As you can see, only 2.2% are ages 80 and over. So it's mostly here, the youth that are getting COVID. And that could be for many reasons, right? Some youth are gathering, youth live together with other siblings. I mean, so many different reasons, but it's not just an older, adults with disease, it's affecting our youth. And then here in our numbers are cases by race. I like to focus on the Latino community, one, because I think most of us represent the Latino community as well as Indigenous community. And so we are approximately 50% of the population in Santa Clara County. So 49.8, 50%. I'm sorry, we are 25.8% of the population. The Latinos make up 25% of the population in Santa Clara County, but we represent 49.8%. So almost 50% of the cases of COVID are represented by Latinos. And I mention this because, as some of us, right, grew up Latinos, we are indigenous, right? Like I know I represent the Wirarica Nation, and so that's affecting our community. And so, if you really think about that, we are only 25.8% of the population, but we represent 50% of the cases. That's a high number. And what does that mean? That we're dying, right? Like those that are getting it that don't have the vaccine, there's a lot of people that are passing away, unfortunately. And so this is a daily update that we have every day on our website. We have it on our website. We have it on our social media pages. So I got the most updated one that I got was for the 28th of July, 83.8% of those 12 and older with at least one vaccine dose. And then 77.7% of those 12 and older who completed the vaccination, so got both doses, or those that got the Johnson & Johnson got one. And at that point, it was about 180 new cases average. Now we're at approximately 200. 2 weeks ago, we were at 60. So if you think about it, our numbers are growing a lot. So about 2 weeks ago, we were at 60. Last week, we were about 180. And today we're at 200 of the rolling, 200 plus of the rolling average. So the numbers are continuing to grow, which is part of the reason why we had that mandate announcement today. And then these are the vaccinated residents in our county, ages 12 and older. And so again, I'm gonna just highlight the race and ethnicity. If you can see here, specifically the numbers, 63.9% of the African American, 70.2% of American Indian, 95% of Asian, and 64% of the Hispanic Latino community, 52.4% multi-race, 95% of the Native Hawaiian, and then 67.7% of the white. So if you remember, I said earlier about 83 numbers here, that's only 64%. So the 83% doesn't really reflect our community, our population. Young people, again, just highlighting the COVID cases by age group, a pie graph to see the numbers, and to see that most of the cases are here. And the youth 19 and under, are right here again, 18.5%, 20 to 29, and then 30 to 39. So if you see this youth age here are the highest numbers, more than half of COVID. Again, COVID is not just affecting those that are older or, elders. And so I want to highlight some resources in our county. I know some of you might be writing down phone numbers. I highlighted, they're all important, but I highlighted some of those that I thought were a little bit more important. At least, for me, my community, some that, we access often. So the COVID support line, this number you can call and ask anything related to COVID, 408-808-7770. I'm going to go down here a little bit to the mental health services, because as we know, COVID has impacted all of us in one way, shape, or form. For some of us, we've been stuck at home, doing school from home, working from home, dealing with our parents all day from home, all day, every day, 24/7. And that affects the mental health, right? And so, a lot of these different activities that we see promoted, going to the park, all those things are important because it helps release some of the stress, to get out of the house, to get out of the room. But for some of us, it's just been too much. We've lost family members. We've lost our jobs. We don't know, it's affected us in different ways. So write down this number, mental health services, 1-800-704-0900. You may never know if you might need it, or a neighbor or somebody that you know. And then a crisis hotline number, the 1-855-278-4204. And that is available 24 hours, 7 days a week. So that's also a good number to have, or text 741-741, and you could text renew and somebody will respond to you 24 hours, 7 days a week. Again, you never know when the need is there. You never know when you're just feeling so lonely that you're like, I need to check in with somebody. And here is our different media pages that we have. We have a Facebook page. I know some of you are like, that's for older people. And yes, maybe for your parents or your grandparents. We have Facebook in English and Spanish. Actually, Dr. Solorio-Cortes comes on every month, and myself, I facilitate a question and answer period in English and Spanish. So it might be good for your parents to come on. And then we have the Instagram, for those that are younger and want to get on Instagram and just look at what different updates we have. Make sure to log on both. Maybe you never know what kind of access you might need, or different flyers that come out. We also do a bulletin every week, and then a summary of what the different updates are for the week. So it's good to have access to these pages. And then, we also have things like this, just an example, COVID-19 vaccines. Which one can my son get, or his daughter, 12 to 17? What are, specific questions around the vaccines that we like to put on to inform our community about, different updates, what is appropriate for a youth. Can they get the Moderna? No, they can't. Why? And things like that. And so that's in regards to our county, just in general. Now I'm going to go ahead and pass it over to our doctor, Gerardo Solorio-Cortes, to talk a little bit about the vaccine and what that does and what that's about.
Thank you, Corina, for that excellent introduction. So yeah, let me go over a little bit on the science of vaccines. So as we know, vaccines are made in the laboratory. They're usually injected into a person to help them develop their immunity. The whole purpose of the vaccines is to find a way for your own body with that vaccine to make antibodies. And these antibodies is your defense system when the real infection wants to get in. So you basically, what you're trying to do is, immunization's purpose is to prevent, number one, infection, or number two, and somehow that vaccine helps lessen the severity of the disease. Next. So, a big misconception, not only for COVID-19 vaccine, but just, vaccines in general, for example, the flu vaccine. Do we inject you with the flu, the actual virus, so that you get sick and make your antibodies? And that's incorrect. And it holds true also with the COVID vaccines. They are not injecting you any any real genetic material that's that's the actual virus. It's pretty much for the Pfizer and Moderna, we are injecting you, or the vaccines are mRNA particles. They're embedded in a circular fatty vehicle, very minuscule, it's microscopic. The mRNA goes in there, and once it gets into your body and your cells, it uses the cells to make these antibodies that I'm talking about. The Johnson & Johnson vaccine is a little bit different. It actually uses um, a dead virus. So don't get scared. We've used this all the time in other kinds of, medicines or vaccines. So it actually uses a part of a killed common cold virus, the adenovirus, and part of the actual genetic material for the COVID vaccine is inserted in that adenovirus, and then it's that vaccine that goes in to the patient, and the genetic material makes the future antibodies. So again, it's not anything to do with a live COVID virus. Next. So we know that Pfizer and Moderna are 2 shots. The Pfizer is given 21 days apart, and Moderna is given 28 days apart. I think at this point, I do want to make, just in case, because I know it's been brought up, and you probably have relatives who have waited, or friends or whoever have waited beyond those 21 days or 28 days. And the short answer is, if they haven't gotten their second vaccine, they should get it as soon as possible, even if they've waited, 2-3 months out. The CDC and studies have been done that say, hey, it's okay. We wanted for you to do it at 21 or 28 days, but if you waited this long, we still want you to get your second vaccine. So yeah, it takes a few weeks for your immune system to make the antibodies. So technically, you will be fully vaccinated about 2 weeks after your second shot, Moderna or Pfizer, or your 1 shot, Johnson & Johnson. Before that, you would call yourself partially vaccinated. And I think, I'm adding a little bit more stuff just so that it kind of relates to stuff that you'll see coming out. For example, the partially vaccinated, you might see some individuals, get sick with COVID within that interim time. And that's what it means with partially vaccinated, because technically they were not fully vaccinated. They were still within that 2-week period where you could become vaccinated within any time. The main side effects. So the original studies, if you look at, Corina was just talking about how we've been doing this for a few months, and I had to go back and look at the original, Moderna and Pfizer studies, and they were all done with like 40,000 individuals. And very important to note, there was a mixture of young, older individuals, and also ethno-racial backgrounds and countries. And what we found out in those studies, Moderna, Pfizer, is that for the most part, people did get side effects, but the most it would last, it would be 48 hours. The headache, the muscle aches, fever, chills, or even just, ending or staying in bed for a few days, and again going back to the 2 days at maximum. It happened, but this is a minimal amount of individuals in those studies. Now, we have millions. I think we're approaching at 300 million, vaccines given, and it holds true, meaning that by and large, the main side effects you'll get is what I just said, and it'll only last you for a few hours, at the most 2 days. Yes, there's some outliers like everything else, like anything in medicine and science, but they're very few. Next. this is talking about herd immunity. And again, going back to you know, July, August, September of 2020, we're talking about, herd immunity being like 70, 75%. Then we moved it up to 80%. We're getting to that level. And what this means is that you want to get people immune. And how are you going to get people immune? Number one, the easiest way is to get infected. But as we already know, that's not the way we want to go with COVID-19, because it hurts a lot of individuals, it kills individuals, and it gets our healthcare system, packed. So the answer is vaccination. So that the numbers that Corina mentioned earlier about percentages of people getting vaccinated or not, we want to get to that level of 80% and above. And actually, it's a move with COVID. I've always said that it's a moving target, because each day we're learning something. So the question would be, what is that herd immunity number? Is it 95%? I mean, is it 90? Is it 95%? I've heard that number. We just need to get it as high as possible. In our situation, specifically talking about the Latinx community, we're in the 60s, so we're below this 80%. So we need to get to the higher number so that we reach this herd immunity. And this cartoon is very important. I think it gets to the point that if you got people vaccinated, that means you have no opportunity for this virus to get into a person. That means, number one, no infection. Number two, no asymptomatic transmission where they could get other people infected without any symptoms. And number three, very important, which it kind of leads to the Delta variant. You don't allow to this virus to get into a person and allow it to mutate and become the Lambda variant or the Delta plus variant. So again, going back to the very important to get as many as people vaccinated. And I'll leave that to Corina.
Thank you so much. And I'm going to reiterate, the importance of getting vaccinated, and, close it off and hand it over to the youth. I'm going to tell you a personal story. This past week, we had a community member who was against the vaccine, and, against the vaccine for anybody in their family. And unfortunately, the father in that family caught COVID and is now in the hospital and is not doing very good. And so they're like, I want to get the vaccine now. Like I changed my mind. Understandable, right? And no judgment with anybody. I just like to share real stories in our community today, right now, to highlight the importance that if you're healthy right now and you're feeling good, go get it. Because unfortunately, and the doctor can attest to this, that family cannot get their COVID vaccine right now. They have to wait a period. Yep. And so the father's in the hospital they're really sick. They were all against the vaccine for their reasons, and believing in myths, unfortunately, and or, maybe realities. And so for myself, when I took the vaccine, I thought, do I want to, get this vaccine and maybe in 20 years, maybe, I don't think so, but because I get to keep myself healthy, but maybe something comes up because I got the vaccine. But at least I lived those extra 20 years, right? Or do I want to be in the hospital right now, connected, intubated, and maybe dead in a couple of months because it's happened to peers? Yes. For me, what is a pro and the con? Yes. So for me, it was more important to be healthy now, in the now, knowing that the vaccine will fight against, the diseases and the variants. And I might acquire COVID, but I won't get as sick as if it was my peer with the same health, the same age, that didn't get the vaccine. And so I just wanted to share that, if you're healthy, if you haven't gotten it, if you're like, should I get it? For me personally, there's so many more pros in getting it. So with that, I'm going to go ahead and turn it over back to our youth. Thank you so much for coordinating this. Thank you so much for getting the word out. Very proud of each and every one of you for everything you're doing for our community. and all the things that you're going to do. If we can be of support, let us know. We're here to support, and we'll be ready for questions and answers in that time.
Thank you both. So we had made a mention that there was going to be some trivia questions. So Rosalind, one of our youth ambassadors, is going to go ahead and facilitate our trivia portion of it. Make sure that your chat is open because you will need that. So we have some prizes for the trivia. So the first question, second question, and third question. If you answer the first question correct, you're going to get 2 weekend passes to Raging Waters. The second question, 2 Great America tickets. And the third question, a $50 DoorDash gift card. So make sure that your chat is open and you're ready to answer the questions. And I'll go ahead and pass it to Rosalind for the trivia questions.
Thank you, Miriam, as well as thank you, Corina and Dr. Solorio-Cortes. And before we get into our Q&A, we will be doing a quick trivia question round. The first person to answer these questions in the chat wins a prize. So to begin, our first question of the night is, what's the nickname that people have given to COVID-19? So Daniela said Chinese virus, correct. She was the first person in the chat, so congratulations, Daniela. Okay, now let's go on to the second question, which is, name 2 locations where you can get your COVID vaccine. Congratulations, Angelina. Angelina said doctors or CVS. So, as well as you can also go to the Indian Health Center or other pharmacies to get it, and various other locations as well. Last but not least, our last question, our third question is, what are 2 ways we can keep our community safe from COVID? Congratulations, Angelina. Angelina said face masks and vaccine, correct, as well as we can say keeping our 6 feet distance, sanitizing our hands, and various other solutions. Well, congratulations to our winners of our quick trivia question round. And now I will pass it on to Miriam.
Okay, Angelina is like winning everything. So congratulations to all of you all. We're gonna go ahead and transition into our Q&A part of the evening. So if you all have any questions, feel free, if you look at the bottom of your screen, there's an option that says Q&A with like 2 little chat boxes, it looks like. Go ahead and click that, and then you are able to answer a question, type in a question there. And those will be the ones that Corina and Dr. Solorio-Cortes will be able to see to answer. So Jose is going to help facilitate asking the question so that Corina and Dr. Solorio-Cortes can answer all of the ones that you have. You can also, if you have an anonymous question, maybe you want to ask the question, but you don't want us to see your name or anything like that, you can ask it anonymously. There's an option for that as well. So I'll go ahead and pass it on to Jose to ask the first question.
Thank you, Miriam. So let's start off with the first question. There's 4 as of right now, but don't be afraid to type in something else. Question 1, what do you mean by killed viruses?
It's an excellent question. Thank you for that question. So I was talking more about it with the J&J vaccine, where they use the common cold virus, which is the technical term is the adenovirus, ADENO virus. So in the lab, we know what it is. We take off those things in the DNA that make it infectious, and we use part of it as a vehicle. And then that's where we add in the actual COVID vaccine to that dead adenovirus. So we use the whole thing so that as a vehicle to get into the body, the blood, the cell, and that makes the antibodies. This is different from the mRNA vaccines, which there's no, adenovirus used. It's pretty much, it's the newer technology that we use, which is, I say new, but it's been there for like 30 years. And we're using that, the mRNA, but it's different from the J&J. mRNA goes in a vehicle that's made out of pretty much like fat. It's a very minuscule vehicle, and that goes into your the blood and then your cells.
Thank you. Second question by Elijah. Are side effects of the vaccine for youth between the age of 12 through 17 different in way from those adults experience?
No, I think by and large, very similar reactions, side effects that you get that people experience. One thing we did see more is the inflammation in the heart of some adolescents, and it was mainly found more in boys. The CDC, the FDA, they were they paid attention to these cases, but looking at the benefits and risks and knowing that it doesn't happen often. I forget the exact number percentage wise, how many myocarditis, which is the inflammation of the heart that happens with, and it's only the mRNA vaccines with Johnson and Johnson, with Moderna and Pfizer. So I would say the only difference that I know of side effects wise that would happen more in that could happen, that the studies have said maybe you'll see more of this, and it's the myocarditis in adolescents. But it's still CDC, FDA's still says, even knowing that, we still, as Corina has said, we want protection against the virus.
And Doctor, in regards to the numbers, obviously as a parent, if I were to hear that information, I'd be like,
Yeah.
But I'm assuming the number is really
it's
small.
like 0.111%. It's super low.
Okay.
Right? And I think it's an excellent, and thank you for clarifying. It's just going back to the clots. People, there was some more clotting in the J&J vaccine that, there was a pause to the vaccine a few months ago, and it still was very minuscule. It's still, again, 0.001%. So
and that's a good,
the risks being so low and the benefits protecting against disease, CDC FDA said, you know what, we're still going to recommend it, and it's a strong recommendation.
and that's good that you mentioned the pause, because the government will definitely go in and pause, and study it before bringing it back out. So thank you for explaining that. And the only thing I'll add to that is my daughter's 12, and then we have a cousin who's 16. 16-year-old went to go get her vaccine. She was fine, didn't get any symptoms. Went with my daughter to get her vaccine so she can get a ticket for the raffle for the concert. They both were like jumping and playing and dancing.
Okay. Next question. When will the vaccine be available to those under 12 years old?
Very good question. I think that's a $64,000 question that we don't know yet. I just looking at reports and how it came out for the adults. I think people want to, or the scientists, FDA, CDC is probably looking towards winter. Late winter. So that's my best guess right now.
Next question. I got Moderna vaccine. If we need booster shots, would I need to get it from Moderna, or can it be any other booster shot?
A very good question. Excellent question. And the short answer is the authorization that's approved now pretty much says that if you start one series, you got to stick with that one. So if you started with Pfizer, you got to finish off with Pfizer. If you start with Moderna, you finish off with Moderna. If you do the J&J, you do one. You don't go do J&J and then start Moderna and Pfizer again. That's not what the authorization or recommendations are. So that's basically the short answer. Have there been studies that looked at people in these last 7 months who have gotten the Pfizer first and they got Moderna? And we call it a mixed vaccination, and the answer is yes. We've looked at that. We looked at the data. We looked at the antibodies that were produced after that mixed vaccination, Moderna, Pfizer. And at this point, the studies that I've read pretty much say that it's, it's okay, that no bad side effects happened. And in fact, you did have a good response to the antibodies, but that doesn't mean that we're, promoting that. We're still promoting that if you stick with Moderna, stay with Moderna. If you start with Pfizer, stay with Pfizer.
Next question. This is for Dr. Cortez. What is the best way to address myths and misconceptions for patients such as the vaccine causing infertility?
Excellent question as well. And I think adolescents, young people, it will be more, pertinent and very important, kind of like I think Corina touched upon what's happening now, but also what's going to happen 20, 40 years from now. And that's important. So far, the science says that fertility has been no different from someone being vaccinated versus unvaccinated. So the studies that were done in Moderna and Pfizer, you had women become pregnant in equal numbers, both in the vaccinated versus unvaccinated. So that will be an answer that, there's no difference, that from what we know of right now, it doesn't affect fertility. Furthermore, yesterday I actually Googled in my Scholar database, and one of the journals for urology actually looked at the sperm counts for individuals that had gotten the vaccine, again, vaccinated versus unvaccinated, and the semen, quantities were the same, similar. Again, this adding more data that these vaccines are safe, and in terms of fertility, it doesn't affect it, that you're going to be okay.
Next question. If you were exposed to COVID in person, in close contact, tested positive and had symptoms, and tested 5 days after exposure and were negative, do you continue to quarantine?
Excellent question. And with this new Delta variant going up, things have changed recently. For example, now if you're, for example, vaccinated and exposed to someone who's positive for COVID, 1 month ago, like, we were very positive and we're saying, well, you're actually protected, you should be okay. But now, in like the last week, because of the Delta variant, we're saying that even if you were vaccinated, you should probably get tested 5 days after this exposure. So I'm kind of answering the question. The questions, the one they had asked, I think it popped out, but it's someone that has had symptoms. And the question that I had was, is this person vaccinated or not? Because it would kind of affect what I would do and how high of a probability that would have asymptomatic COVID. By and large, usually, so if you have symptoms, you get tested. If you're negative and it's day number 5, and if you're getting better, I would say you probably would be okay to get off quarantine after day number 10, just to be more, especially now with the Delta variant going on, to be on the safe side. It's very individual, and again, I bring in the vaccine or not to determine what to do with that individual. So I would bring it up to the doctor or your healthcare professional as well.
Um, what incentives would be offered during the Indian Health Center SCV Vax event this Friday at the farmers market? Who is eligible and what are the details?
I think Medium can answer
Yeah,
that.
yeah, that one's for us. So this Friday, I know Jose had kind of mentioned in his intro that we are having a community vaccine event. It's happening this Friday at the San Jose Downtown Farmers Market. The address for that is 450 South First Street. So every Friday, or I think it's almost every weekend, they have a farmers market in different parts of San Jose. This one on Friday is in downtown, and we are hosting a vaccine event where anyone who is 12 plus can come and get their vaccine. We're doing it in collaboration with the Pacific Coast Farmers Market Association, the San Jose Downtown Association, also our immunization team, Daniela and Angelina. So we're really excited about that. So anybody who is over 12 years old is welcome to come and get vaccinated. We'll have Pfizer and J&J, I believe. Um, some of the incentives, those who do come and get vaccinated, there's $50 gift card for full vaccination, which means that if you get the Johnson and Johnson, since it's one shot, you'll get the $50 there. If you get Pfizer, since it's a two-shot, 25 at the first dose and 25 at the second dose. We'll also have Carrot Cash, which is essentially like a gift card or gift money that you could use at the farmers market. So the Farmers Market Association will be giving everybody some funds so they could shop at the farmers market, get your groceries, your produce. And then we also will have snack bags and gift bags that our youth ambassadors are putting together that'll have like a bunch of different like granola bars and fruit snacks and all different yummy snacks, and also some gifts from us from our Family Resource Center. And then the farmers market is donating some produce for those who get vaccinated to come and get some of that. So there'll be lots of good stuff present. If you haven't gotten your vaccine yet, or if there are folks in your circles that are looking to get a vaccine, then feel free to join us this Friday. I'll be sending out the information as well to everyone who's here, and it's posted on our Facebook page also. We also have another vaccine event that's happening on Saturday, August 7th. I don't have the details for those on hand, but it is also I'm assuming it's also going to be posted on our Facebook page. So yeah, that's the answer to that one.
Nice. All right. Is the blood clotting from a pre-existing condition that the person has, or as a side effect of the vaccine itself?
Excellent question. And we're talking about it was a Johnson and Johnson vaccine where there were more events of blood clotting in the brain, and it happened. The data was more for women and from the ages of like 18 to 50s, and these were individuals that didn't have blood clots before, but the CDC, FDA saw more cases of these with this Johnson and Johnson vaccine.
Nice. And then there's this big question that I quickly read and actually felt like, all right, the misconception commonly heard from young women is that after getting the COVID vaccine, they experience menstrual cycle changes. How could you address these concerns?
The likelihood of the vaccines causing issues with menstrual cycles, gynecological issues, obstetric issues is very minimal.
Next question. What's the difference between Delta and Delta Plus?
Good, very good question. I think, when we hear Delta, when we hear Alpha, Gamma, these are all the different names that were given to the variants. We had the original COVID, And as you all may know, and specifically, talking to a younger population or younger audience, being closer to the science and just thinking about just, evolution and how things change. So, I would look at the Delta and saying, that the COVID or SARS-CoV-2, it wants to get better to live and infect people. So what you're seeing now is the Delta being the predominant form in the US and a lot of the parts of the world. And reason being is because it actually became a variant that allowed it to become more infectious to people. Now, the actual Delta Plus is a subset of Delta with another, genetic mutation. And the question now is Delta versus Delta Plus different, or is it, is Delta Plus similar to Delta in terms of the way the infectivity? Is it as infectious as Delta? And then the answers right now look like, yeah, they're pretty much the same. And again, I go back to, but each day we'll find out if Delta Plus, for example, is more infectious than the regular, Delta variant. So I would see variants more as a, there's genetic material that changes for the better of the virus, which it means it's detrimental to us. Even more important, again, plugging it in, if you become vaccinated, you allow less interaction of the virus into a human cell.
And finally, the last but also quick question is, do you think we'll have to get a shot every year?
We may need a booster, in 3 to 6 months, and that may be it. Or it may be that, it becomes, a variant, and then we'll need a booster every year, like we do with the flu shot. So I think right now we don't know yet. And then it's going to be what the future and the infectivity that's going to dictate, and then people getting affected. And furthermore, I would add, people getting infected that are immunized now, if they're becoming infected and they become sick, then that might push, officials to say, well, we might need a booster sooner. At this moment, being vaccinated, yes, very low chance of getting the actual COVID disease. But if you do get it, it's a mild disease, or moderate, at most moderate. You will not end up in the hospital, and you will not end up dead. And that's what vaccines, no vaccine is going to be 100%. But if a vaccine comes out and protects you against, hospitalization and death, and even, protecting you against these variants, and we're already, 16 months into this pandemic, we call that a win. And that's why you see Dr. Fauci and everyone else saying, that we're doing great, and that the current vaccines that you'll get will still protect you against Delta. So if you're not vaccinated, get vaccinated.
Yes, so all the questions. Thank you both so much. Those were some really great questions. I personally feel good knowing everything that was asked. Some of those questions I had as well. So we have one more raffle before we close out for the AirPods. So everyone's getting a few entries here. Oh, doesn't want to catch it. Let me spin it. Oh. Okay, and the winner is initials EH. So I'll connect with you all to get those prizes to you, and I'll pass it over to Jose to close us out.
Thank you so much, Miriam, but also thank you so much for everyone who came. Thank you, Dr. Solorio-Cortes and Corina Herrera-Loera for coming and presenting. The Indian Health Center also offers COVID testing for established patients and free vaccinations to anyone and everyone. Check out at our website for more details. Be sure to come to our community event, vaccine community event, this Friday, August 6th from 10 a.m. to 1 p.m. at the San Jose Downtown Farmers Market. We'll be sending out a flyer everyone who RSVP'd to this webinar.
Thank you for inviting me. Excellent work. Thank you.
Yes, thank you.
Thank you all.